Constituent Factors Observed in Viral Diseases, Part 5 of 5. Pause text and illustrations for detailed study. Refer to the previously posted Constituent Factors Observed in Viral Diseases, Parts 1 through 4. Viral-induced immune system pathology can occur due to cytotoxic T cell activity, causative of tissue and organ injury, antibody and complement interaction, cytokine-induced inflammation, antibody-dependent cytotoxic cell activity, or antigen-antibody reaction specific to the immune system. Cellular immunity is a T lymphocyte-mediated response to a specific antigen transfer from a non-immunized individual, not via plasma or serum, but from the lymphocytes of another immunized person. This is in contrast to antibody-mediated humoral immunity. A cytokine storm is a severe immune system reaction that results from an infection in which an excess of cytokines is released into the blood too quickly, causing collateral damage. The definition of sepsis as a condition associated with bacterial infections in the blood has been expanded to include infections resulting in immune system dysregulation accompanied by systemic inflammation, as well as aberrant vasoactivity resulting in blood pressure decrease, vasodilatory shock, and progressive remote organ injury and failure. Such hypercytokinemia results in signs and symptoms including fever, fatigue, headache, inflammation, joint and muscle pain, and nausea, corresponding to severe life-threatening disease and death upon multiple organ failure. The molecular communication between cytokines and the aforementioned complement system is manifest in the ability of cytokines to enhance productive components of the complement cascade capable of enhancing or inhibiting cytokine production in the immune system response to infection. An excess of complement in the immune response is similarly harmful, as is the case with excessive cytokine production. One example is the hyperinflammatory reaction that can occur during COVID-19 infection. It's characterized by severe pulmonary inflammation and edema, acute severe lung tissue damage and scarring, lung collapse, and associated respiratory distress, causing an inability to maintain adequate pulmonary ventilation and oxygen perfusion, as well as other associated complications and symptoms are characteristic of COVID-19 pathology. Another example is the symptom observed in COVID-19 patients who also exhibited a skin rash in the form of a lesion that erupts on the oral mucosa, referred to as an anthema. Petechia refers to a non-raised purplish-red spot caused by intradermal or submucosal hemorrhage. In the presence of a petechial pattern, enanthema are suggestive of a viral etiology, such as COVID-19. Purple-colored foot lesions resembling chickenpox, measles, or chilblains observed around the toes, usually healing without leaving marks on the skin of COVID-19 patients, are also believed to be symptomatic of the disease. The role cytokines and complement play in the immune system responses and associated clinical complications observed in COVID-19 infections have yet to be fully defined. Another exaggerated post-infectious cytokine storm associated with the coronavirus is multisystem inflammatory syndrome C, observed in children. This newly discovered condition causes arterial swelling throughout the body. Symptoms include inflammation in the brain, eyes, gastrointestinal organs, kidneys, or lungs, causing persistent fever, diarrhea, rashes, vomiting, red in the tongue and eyes. It is also referred to as pediatric inflammatory multisystem syndrome, temporarily associated with SARS-CoV-2. The exact cause of this syndrome has yet to be discovered. It is not contagious. About half of all COVID-19 deaths are believed to be attributable to the cytokine storm. Morbidity and mortality often result more from these cytokine storm reactions than the viral infection itself. IgG, or immunoglobulin G, plays a role in the coronavirus immune response since it responds against the virus spike protein. Antibodies protect against reinfection. They may also attenuate disease attributable to breakthrough infection in a previously vaccinated individual that the inoculation was intended to prevent. It has been estimated that about 40% of individuals infected by SARS-CoV-2 are asymptomatic. Immunoglobulin and immunosuppressive agents are part of the drug therapy administered to COVID-19 patients to treat the life-threatening inflammation and associated symptoms affecting various elements of the body, including the brain, eyes, gastrointestinal organs, heart, kidneys, lungs, liver, pancreas, and skin. Antibody tests may identify individuals who have experienced an adaptive immune response to SARS-CoV-2 immunoglobulin G antibodies, indicative of previous or recent infection. Seroconversion is the development of antibodies in response to prior infection or immunization confirmable upon testing. The degree of post-infection antibody resistance or antibody-mediated protective immunity has yet to be fully ascertained. This test is not diagnostic for acute SARS-CoV-2 infection. A polymer is a compound formed by a union of smaller molecules catalyzed by the enzyme polymerase. The polymerase chain reaction, or PCR test, amplifies and copies small DNA segments for molecular and genetic analysis, as well as detection and identification of bacteria and viruses. Such molecular laboratory tests for the detection of SARS-CoV-2 DNA are diagnostic of acute infection in the presence of a positive result. A biomarker is a biological molecule that serves as a marker indicating the presence of a substance, structure, or process of interest. C-reactive protein, CRP, is a biomarker whose level rises in the blood in response to inflammatory conditions, including certain cancers, as an acute phase protein. A dimer is defined as a compound resulting from the combination of two identical simpler molecules, or as a capsomer comprising two structural subunits. Fibrin is an insoluble protein formed from the soluble protein fibrinogen in blood plasma, whose creation is catalyzed by the proteolytic function of the thrombin enzyme, comprising the essential element of blood clotting. The D-dimer biomarker is a degradation product of fibrin, as a crosslink not occurring in fibrinogen testing specifically for fibrin. Fibrin is one of the elements present in the excess pulmonary fluid present during the exaggerated inflammatory reactions observed in some COVID-19 patients. The cytokine interleukin 6, IL-6, is a biomarker released by leukocytes in response to stimuli and is involved in B-cell differentiation into plasma cells that is generally not detected in normal serum, plasma, cerebrospinal fluid, or joint fluid. It is an acute phase reactant and endogenous pyrogen. Lactate dehydrogenase, LDH, is a protein enzyme biomarker in the blood and other body fluids, serving as a marker of tissue damage or disease when present in excessive levels in the blood. Ferritin is an iron apoferritin complex biomarker that is the principal form of iron storage in the body, occurring in the bone marrow, gastrointestinal system, liver, spleen, and reticuloendothelial cells, found at low levels proportional to its amount in the body. Unusually elevated serum levels of ferritin occur in the presence of inflammation and liver disease, being indicative of pathology. It has been observed that abnormal levels of these biomarkers are indicative of possible disease severity in COVID-19 patients, amongst others. Such increased biomarker levels have been associated with an associated risk of intensive care unit admission, ventilator support, and death. Timely blood-borne biomarker testing as well as accurate patient care plan assessment and implementation can mitigate morbidity and mortality risk in COVID-19, as well as other types of patients. SARS-CoV-2 patients can exhibit a massive persistence of the virus in the lungs. Large fusions of nucleated cells can occur in the lungs due to the aforementioned ability of spike proteins to fuse infected cells to one another. Massive thrombosis within the lungs may also occur. Cell fusion and blood clotting significantly alter the structure and appearance of the lungs to a degree that radiographic interpretation for diagnostic purposes as well as clinical treatment become very difficult. These factors also play a significant role in patient morbidity and mortality. It has been observed that recovered COVID-19 patient neutralizing antibody levels wane in 2 or 3 months. In the case of recovered common cold coronavirus patients, such short-term immunity and the possibility of reinfection within just a few months has also been observed. These silent spreaders are also capable of subsequently infecting other individuals. Sudden acute respiratory syndrome, SARS-CoV, and Middle East respiratory syndrome, MERS-CoV, are similar coronaviruses involving patients in which short-term immunity is somewhat more durable, with the possibility of reinfection within just about a year. Horizontal transmission takes place between different individuals when viral entry and exit occur via surfaces, the bloodstream or insect bite. Vertical transmission occurs in the ovum, in the placenta during birth, via milk, and via the fluid colostrum secreted by the mammary glands before or after birth, which is composed of carbohydrate, fat, protein, and maternal immunoglobulin. The portal of entry may differ from the mode of exit. The degree of viral load, as well as any related complications, is determinative of morbidity and mortality. Chinese pangolin and bat illustration. Viral zoonosis is the transmission of infection from non-human animals to humans. Such cross-species host switching of enzootic viruses to humans is the case with the coronavirus. This virus resides in horseshoe bats and pangolins, considered to be edible delicacies in mainland China. Pangolin scales as well as bat guano are used in the making of various Chinese medications. Infection via ingestion of medication is believed to be unlikely, since the various products tend to be subjected to high sterilizing heat prior to the culmination of the manufacturing and packaging processes. It has been speculated that humans handling infectious bat guano during the harvesting and or the initial material handling process for Chinese medicine manufacture may become infected with the disease. Further speculation attributes possible exposure and infection of miners and spelunkers to breathing air or contacting surfaces contaminated by infectious guano. Although coronavirus can be detected in bat saliva and blood, human infection via this route is considered to be unlikely, since bats, including those associated with the disease, do not commonly bite human beings. The exact mechanism of coronavirus zoonosis has yet to be defined. Confirmed cases of SARS-CoV-2 have been observed in domestic cats and dogs, as well as in zoo lions and tigers in the United States. Previous coronaviruses are believed to have passed from bats to humans via an intermediary mammal. It has been proposed that the pangolin performed this function as regards COVID-19. Bats are known reservoirs for viruses, such as the Ebola and rabies viruses, besides SARS-CoV-19. Bats live in dense and large colonies to which pathogens and viruses are commonly transmitted, due to their comings and goings where they transfer same to each other. Their immune systems are continually being exposed to and subsequently adapt to these antigenic changes. The constancy of this process is the motive force behind the evolution of immunity in bats and their ability to adapt and survive in the long term despite these numerous environmental challenges. Mutation or elimination of various genes that play a role in inflammation have been observed in bats. This mitigates the possibility of the aforementioned life-threatening, exaggerated inflammatory reaction from commonly occurring in SARS-CoV-2 infected bats that can take place with human beings. Bats play a role as an environmental vector for SARS-CoV-2 disease transmission to human beings. Illustration of community or herd immunity. Immunity is the ability of the body to protect against infectious disease, derived from its genetic innate capabilities or its acquired defenses from previous exposure or vaccination. Active immunity results from specific vaccination and the immunological memory developed in response to antigenic stimuli, resulting from previous viral inoculation and infection. B cells are white blood cells that produce protein antibodies capable of binding to and specifically neutralizing and eliminating a virus. The earliest B cells produced by the immune system in response to an infection are relatively rudimental in function. The B cell immune response later becomes better capable of producing more precise antibodies, better able to provide for a focused and effective neutralizing attack against invading viral antigen. B cells are specifically capable of immunological memory subsequent to previous viral exposure or vaccination, productive of a protective immune system response against a future encounter with the same viral antigen. Helper T cells function in B cell activation and are believed to be capable of recognizing the SARS-CoV-2 spike protein. Cytotoxic T cells function in the targeting and destruction of infected cells and are believed to be specifically involved in the SARS-CoV-2 immune response. Vaccination may also be capable of inducing humoral as well as cellular immune responses with reactive T cells capable of providing protection against COVID-19 infection. Their involvement in immunological memory and the immune response in this regard is not fully known. COVID-19 vaccines approved for mass inoculation have just been created. Passive immunity results from the transfer of specific antibodies or lymphocytes from a previously exposed immune donor. Both are forms of acquired immunity. Herd immunity involves the resistance of infection due to previous large-scale exposure of the population, already possessing immunity, lessening the chances for future infection of a susceptible individual. It is estimated to involve 70 to 90% achievement of post-exposure immunity by an affected population, dependent upon the degree of disease contagion. COVID-19 patients that appear to have recovered from an initial infection, who exhibit symptoms of persistent or subsequent infection and symptoms, are referred to as long haulers. COVID-19 infected superspreaders are capable of transmitting infection to large amounts of previously uninfected individuals. Breakthrough cases subsequent to viral infection and vaccination indicate that infection, usually by a variant of the virus, broke through the immunity the inoculation should have ostensibly conferred, causing illness. This has been observed during the COVID-19 pandemic. The notion that presumptive COVID-19 herd immunity can result in a measurable slowing or decrease of pandemic disease progression is yet to be fully determined. Taxonomy is the classification of an organism into particular categories or taxa, comprising species, genus, family, order, class, phylum, and kingdom in ascending order, whose nomenclature is indicative of relationships. The nomenclature of viruses is done according to the guidelines of the International Committee on Taxonomy of Viruses, which concerns itself specifically with the designation and naming of the virus taxa. Coronaviridae refers to the family of the enveloped, single-stranded RNA virus that possesses the crown-like spike appearance of a solar corona on its surface, evident upon electron microscopic examination. 3 names consisting of the disease, the virus, and the species are decided upon by the World Health Organization, an expert virologist, and the International Committee on Taxonomy of Viruses, respectively. In the case of the coronavirus pandemic that originated in 2019, the designated disease name is coronavirus disease 19, abbreviated COVID-19. Co, vir, D, and 19 stand for coronavirus disease and 2019 as the year of initiation, respectively. The designated virus name is Severe Acute Respiratory Syndrome-related Coronavirus 2, SARS-CoV-2. The species name is Severe Acute Respiratory Syndrome-related Coronavirus. The term novel coronavirus refers to a new, previously unidentified coronavirus of similar type, not to be mistaken for the coronaviruses like the common cold that cause mild illness in human beings. The 2019 novel coronavirus, 2019 nCoV, refers to the novel N coronavirus CoV identified by virologists near the end of 2019 that transitioned from epidemic to pandemic status in 2020. Families of genera of viruses affecting vertebrates illustration. Sense positive sense and antisense negative sense refers to the 2 strands of double-stranded DNA, which are the template for transcription. The sense strand contains the specific nucleotide sequence to the messenger RNA encoding for a functional protein. Antisense is the template for transcription containing the complementary nucleotide sequence to the transcribed messenger RNA functioning in protein translation. The sense strand cannot be transcribed into messenger RNA. The antisense strand is the template for translation. One strand of a double-stranded DNA molecule is the negative sense strand, complementary to its positive sense strand, as well as the RNA transcript. This central dogma of genetics and molecular biology illustration states that genetic information is coded in self-replicating DNA that undergoes unidirectional transfer to messenger RNAs during transcription and functions as protein synthesis templates for translation with few exceptions. Note the aforementioned sense-antisense activity explained in the previous illustration. An epidemic involves a sudden, unexpected infectious outbreak occurring in excess of normal expectancy in an area for a relatively limited period of time. A pandemic consists of a widespread infectious epidemic disease outbreak occurring throughout a region, country, continent, or the entire world. Past norms of popular culture have sometimes resulted in epidemic or pandemic viruses being named according to the first reported disease location, the perceived place of origin, or epicenter of infection. Illustration of the Spanish flu in Europe. The coronavirus that originated in 2019 has been identified by media sources using descriptors alleging its identified origin of public release to the local and world community at large as possibly via an infected employee of faulty ventilation system at the Wuhan Institute of Virology of the Chinese Academy of Science in the city of Wuhan in Hubei province in the People's Republic of China. The Institute has reportedly been doing general biological as well as gain-of-function research on various viruses including bat coronaviruses. Gain-of-function research involves the modification of a biological agent, conferring novel beneficial enhanced action to a functional body part or pathogenicity to a bacterium or virus. Public biosafety and biosecurity implications inherent in gain-of-function research impact the biological community at large. Another disputed allegation is that the so-called wet markets in the city of Wuhan, where live and butchered wild game, including bats and pangolins and fish, are present in close quarters for human consumption, may be the source of coronavirus spread. Unsanitary market conditions have reportedly caused cross-contamination from contact between comestibles, surfaces, equipment, and product handling by merchants and consumers. These factors, as well as human consumption, are alleged to also be causative of wholesale community infection. Laboratory tests have isolated COVID-19 from human beings and different kinds of bats. Chinese government officials and others contend that such geographic designations constitute assignations of blame, responsibility, and/or bias toward the people and government of China. Lyme in Connecticut, USA, and Ebola, a river in the Republic of the Congo, Africa, viruses are other examples of popularly named according to their believed place of origin in a manner inconsistent with the criteria of the International Committee on Taxonomy of Viruses. Mutually recognized best practices prescribe that disease nomenclature bear no geographic, national, or racial descriptors that may have biased, offensive, or pejorative connotations. Another example is the so-called Spanish flu of 1918, subsequently believed to have actually originated in disparate locations such as the United States, France, the United Kingdom, Vietnam, and China. Officials from countries that were combatants during World War I from 1914 through 1918 in Europe, as well as the mainstream press, regularly suppressed the severity and extent of illness to their respective constituencies in order to not cause panic, as well as for morale and propaganda purposes, which added to any prevailing misconceptions about this viral communicative disease at that time. During World War I, the United States, France, Great Britain, Italy, Japan, Romania, and Russia were Allied powers engaged in conflict with the Central Powers of Austria-Hungary, Bulgaria, Germany, and the Ottoman Empire. Since Spain was a neutral country prior to the culmination of World War I, from whence the international press extensively received and reported to the world news of the regional effect of what eventually became a global pandemic, it was commonly believed to be the origin of the influenza. The notion was further reinforced by the fact that King Alfonso XIII of Spain became ill from this influenza virus. On the other hand, the Spanish people referred to the disease as the French flu, believing that the illness had spread to them from neighboring France. The first confirmed cases in the United States involved military personnel in the spring of 1918. Government-issued savings bonds were sold at amply attended organized public venues to finance the war effort. These liberty rallies are believed to have been the main source or vector for Spanish flu transmission in the United States. The true time and place of origin of this virus may never be ascertained. Overview of viral infections illustration. The simplified overview of viral infections illustration identifies the main viral infections and the corresponding species affecting human beings. 142 viruses are currently known to have been transmitted from animals to human beings. There is a possibility of yet to be discovered human viruses. Some human viruses have avian or mammalian origins. Many mammalian viruses may be capable of crossing species to humans. Approximately half of all viruses causative of viral outbreaks may become transmissible by human beings. In excess of 2/3 of human viruses are capable of infecting mainly avian and mammalian non-human hosts. New presentations coming soon.